So, for 15 years now, the American Association for Cancer Research has put out this huge annual report. And this year's edition, it really marks a critical milestone. It's a story of some absolutely incredible science. But, it's also sounding a pretty serious alarm about the future. So, what have we learned, and where are we all headed?
All right, let's kick things off with some genuinely fantastic news. Right now, in the United States, there are 18.6 million cancer survivors. That is an all-time high. I mean, think about it. When this report first came out 15 years ago, that number was 12 million. That is a huge, huge leap, and it's a direct result of incredible research and better care.
But here's where things get complicated. Here's the paradox. In this exact same year, it's projected that more than 2 million people in the U.S. will get a new cancer diagnosis. And that staggering number really shows you something important. While we are getting so much better at treating cancer, this disease is still a monumental public health challenge.
Right, so that's the central theme of the whole report, this paradox of progress. So let's dive in and explore the breathtaking advances we've made. But also, we've got to confront the very real challenges that are threatening to slow down all of this momentum.
This number, it tells a story that goes back decades. Since 1991, the overall cancer death rate here in the U.S. has been on a steady decline, which translates to over 4.5 million lives saved. And look, this didn't happen because of one single eureka moment. It's the result of decades of persistent, hard work in prevention, detection, and treatment.
But here's the thing. This progress, it hasn't been a rising tide that lifts all boats. It's been really uneven. You look at breast cancer, and the 5-year survival rate is a really hopeful 92%. But then you look at pancreatic cancer, and it's just a devastatingly low 13%. That stark difference shows us exactly where we need to focus, on these tougher, more resilient cancers.
So how did we get here? How did we make all of this progress? Well, this is where the story gets really exciting. Let's take a look at the scientific revolutions that are completely changing how we fight cancer, starting with the treatments themselves.
Okay, this is just mind-blowing. Back in 2011, when the very first report came out, there was only one FDA-approved immune checkpoint inhibitor. One. You fast forward to today, and we have an entire arsenal. We're talking 15 immune checkpoint inhibitors, 9 adoptive cell therapies, and 9 T-cell engagers. The pace of innovation here has just been explosive.
So what is immunotherapy really? Well, the best way to think about it is like this. Cancer is incredibly sneaky. It's really good at hiding from our immune system, basically putting the brakes on our body's own natural defenses. What immunotherapies do is they come in and release those brakes, unleashing a patient's own immune cells to finally recognize and attack the cancer. It's amazing.
But what does this actually mean for a person, for a patient? Well, this is Quinn Johnson. He's a survivor of a rare cancer called synovial sarcoma, and he got a new type of this therapy. He calls it a silver bullet. His story is just such a powerful reminder that behind every single one of these scientific terms, there's a person whose life has been completely changed.
Okay, so the other huge revolution we've got to talk about is precision medicine. See, for decades, we basically treated cancer based on its address in the body. You had lung cancer or breast cancer and so on. But now we can actually analyze a tumor's unique genetic fingerprint and match patients with therapies that are designed to target those exact molecular drivers. It's a completely personalized approach.
Here's a perfect example. Just this past year, the FDA approved a new drug called vorasidenib. It's the very first targeted therapy for something called low-grade glioma. So instead of this kind of broad-stroke chemo, this drug specifically goes after the mutated proteins that are actually driving this type of brain cancer.
And that brings us to Alex Hepner. As a patient with low-grade glioma, treatments like this one are an absolute game changer. I mean, his words just say it all, right? I'm a walking, talking example of the difference cancer research can make. It connects the work in the lab directly to a person's life. All right, so let's shift gears a bit, because look, as amazing as these new treatments are, the best case scenario is always stopping cancer before it even starts, or at the very least, catching it at its earliest, most treatable stage. And that's all about smarter prevention and detection.
And this right here, this shows just how much power we actually have. Around 40% of all cancers are linked to things we can actually modify. Things we have some control over, like using tobacco, our diet, physical activity, drinking alcohol. It just highlights the massive impact of public health initiatives and our own personal choices.
And when we talk about public health wins, this is one of the biggest. The relentless campaign against tobacco, it has worked.
I mean, just look at that. Steady decline in smoking rates for both adults and for kids. This trend is a huge reason why the overall cancer death rate has been falling for years.
But we absolutely cannot get complacent, because as one risk factor goes down, others are on the rise. Obesity is a major concern right now, and it's linked to an increased risk for several types of cancer. And with more than 40% of adults affected, this has become a new, really urgent front in the fight to prevent cancer.
Okay, now let's talk early detection, because the impact here is it's undeniable. Take colorectal cancer. Since 1975, screening to find and remove precancerous polyps has prevented nearly 60% of potential deaths from the disease. That is just a stunningly effective way to save lives.
And the future of detection? It's getting even better, and frankly, it's incredibly exciting. You've got AI helping radiologists spot tumors with more accuracy. We're seeing the development of liquid biopsies, which could one day detect cancer from a simple blood test. And there are even more accessible at-home screening tests. It's all about finding cancer earlier and making it easier to do so.
So we've seen all this amazing progress, right? In treatment, in prevention, in detection. But the final part of this report is a huge call to action. And honestly, it's got the most urgent message of the whole thing.
So, after everything we've just seen, all these incredible breakthroughs, you have to ask the question, what could possibly derail the incredible momentum that we have built over the last 15 years?
And the answer, the single biggest threat, is a crisis in funding. In 2024, for the first time in nearly a decade, funding for the National Institutes of Health, which is the engine powering most of this research, was cut. Think about it. Every single breakthrough we've talked about is the direct result of sustained investment in science. And right now, that very investment is at risk.
And look, this isn't just some abstract number on a government spreadsheet. These cuts have immediate, real-world consequences. This means promising research just stops. It means clinical trials that could be the last hope for some patients get canceled. And it means we risk losing a whole generation of brilliant young scientists who are forced to leave the field. A survivor named Richard Schluter, who battled head and neck cancer. He puts it perfectly. He says, when science is disrupted, hope is delayed. And for patients who are in that fight, hope and time are literally everything.
So that's where this report leaves us, at a real turning point. We can either build on 15 years of absolutely astounding progress, double down on our investment, and accelerate the pace of discovery, or we can pull back and risk losing the very momentum that has saved millions of lives. The choice is really up to us.